Cancer in the brain or spine creates special issues for treatment. Fortunately, MetroHealth has a specialized response. Dr. James Liu is a neurosurgeon at MetroHealth, and he's here to take us through a team approach to treatment. So who's on the team when it comes to treating cancer of the brain or spine?
Well, it's really a three-pronged approach. It's between the neuro-oncologist, the radiation oncologist, and the neurosurgical oncologist, which is me.
Okay, so is that the same order that somebody would be seeing the doctors in?
Actually, most of the time, no. It depends on the situation. If a patient had a history of cancer, they may have an oncologist that did imaging studies that found something. But if they don't, they may have gone to their general practitioner or walked into the ED and they performed imaging and they found this. In either case, they would call me to assess the imaging and determine the location of the lesion, the size of the lesion, and whether it's benign or not.
Okay. Now, if it turns out to not be benign, and it's a mass in there, then you can tell. Isn't the typical way of going about it, when in doubt, cut it out?
Actually, no. Brain surgery really should be the last resort for obvious reasons that it carries a lot of inherent risks. And depending on the location of the lesions that we are talking about, it can carry very significant risks because there are some parts of the brain that are considered eloquent areas in which we did surgery to, we would actually provide more harm than good.
Ooh, okay.
And so what we would do in these situations is we would assess the location of the lesion, how fast we think it's growing, and what type of lesion it is, and try to decide what kind of approach we want to take. We may choose to take a wait-and-see approach, a more conservative approach, and this decision-making really happens in a place called a tumor board. And this is a regular meeting that I have with my neuro-oncology and radiation oncology colleagues. In these types of tumor boards, we discuss these cases and decide what the best course of treatment is.
Okay.
And if these lesions require a more aggressive treatment approach, then I would just speak with the patient regarding whether surgery and or radiation may be the best way to approach it.
Okay, I've heard of radiation before for cancer. When we're talking about brain or spine, is it the same type of radiation that you've been using for years against cancer?
Well, the conventional radiation that you think about is still available and still can be very effective, but there's actually a newer form of radiation, relatively newer, called stereotactic radiosurgery. And like the name implies, it's a focused type of radiation to a very specific area that allows for a high beam of radiation to a small area. So this allows us to treat a tumor without causing a lot of radiation to other areas of the brain. It can be very effective against certain types of tumors and also have lower side effect profiles compared to conventional radiation.
Because it's a focused beam and less radiation gets everywhere else.
Exactly.
Okay. So if it's radiosurgery, then you as a surgeon, you're the one holding the radiation equipment?
No. The radiation oncologist would be the one doing that, but I work very closely with him to make the planning happen. What I do is I help to delineate the lesion itself and make sure that we target the exact area that we want to target. And the radiation oncologist works with the physicist to apply the radiation necessary. This way, all of us on the team can work together to provide the most effective treatment for our patients.
You know, 3 parts of the team has got to be better than one.
Absolutely.
So that's great. So when you're fighting cancer, you don't want to fight it alone. MetroHealth's team approach to neurological oncology means you have a 3-pronged approach for determining and then administering the best treatment option available. My thanks to Dr. Liu for teaming up with us today.
For more information, call MetroHealth at 216-778-7800 or visit their website, www.metrohealth.org. Next, the smart way